ये पार्टिसिपेंट से ये रिक्वेस्ट है कि जो उनके मोबाइल फोन्स हैं वो माइक से दूर रख दें जरा प्लीज।
Assalamu alaikum everyone and a very warm welcome to Pakistan Cardiac Super League Season 2 powered by Wilson's Pharmaceuticals. Today we are excited to bring you the live action of fourth match between DOW Dolphins and MMC Hunters. They are both are the new teams of the Season 2, and they are under DOW Dolphin is under the mentorship of respectable Professor Tariq Farman Saab, and MMC Hunters are under the mentorship of Dr. Noor Hadi Saab. So, before diving into the excitement of the match, allow me to introduce the expert panels who have graced us today with their presence. We have with us the one and only Professor Muhammad Isaac Saab. He's a distinguished cardiologist at Karachi Institute of Heart Disease, and currently he's live all the way from the UK, and he will also be the umpire of today's match. Alongside with him is Professor Abdul Hamid Siddiqui Saab. He's a former professor of cardiology at Armed Force Institute of Cardiology. And meanwhile, between the match, Professor Fawad Farooq and Professor Hafizur Rahman will also be joining us today for this match. And last, certainly but not the least, I would like to introduce the moderator of today's program, Dr. Hamza Gauri. He's Assistant Professor of Cardiology at Rawalpindi Institute of Cardiology, Rawalpindi. And without a further ado, I will hand over the microphone to Dr. Hamza Gauri to start the further proceeding of the program. So over to Dr. Hamza Gauri.
Thank you very much, Hamza. It's always great to be here. So I welcome you again for this second season of Pakistan Cardiac Super League in collaboration with Pakistan Cardiac Society and Wilson's Pharmaceutical. So we all know last match went to the wire. It was a tough one. Today again we have another league match, and it's going to be held between the DOW Dolphins versus Mardan Medical Complex MMC Hunters. So we'll see whether the Hunters are going to hunt the Dolphins or it's going to be the other way around. So with this, I would also like to take this opportunity to welcome our dignitaries, our chairpersons, and today we have Professor Fawad Farooq and Professor Hafizur Rahman. Along with that, last but definitely not the least, our umpires for the game. We have Professor Muhammad Isaac Saab, welcome sir, and we have Professor Abdul Hamid Siddiqui Saab. So it's great to have everyone. I think with this, I now move to the two teams and their captains to give the introductions of the teams, please. And first, I move to MMC Hunters. And can we have the introductions from the captain?
Camera on kijiye, Hamza. Please. We can't see you.
Okay, we can't see MMC. We can't see the Hunters. Please switch the camera on at Mardan.
No, we can't see you, Hamza.
You can't see me, sir?
Abhi nazar nahi aa rahe.
Okay, so technical team, they can't see me. Okay.
So you have to pin Pakistan Cardiac Super League window.
All right. So, sir, can you see me now?
No. We are missing your beautiful face.
So I think the technical team is on it. So in the meantime,
we can start.
I think, yes, we have the team. So please, MMC, the captain, we would like to have the introductions from MMC Hunters.
This is Dr. Aisha Sayed, representing MMC Hunters as captain.
Okay, the
I'm
captain
Dr.
can...
Amna Salim and...
Okay, good. Thank you. The captain can tell us about the teams, please, quickly.
This is Amna Salim sitting right next to me, and the other one is Sayyida Mahnoor, and on the extreme left is Dr. Ali Zaman.
So welcome.
By the way, MMC is Mardan Medical College or Mardan Medical Center?
Complex.
Complex. Is it attached to the medical college?
Yes, it is.
Okay. And you're all fellows there. What is your position?
Sir, I'm the final year trainee here. And all
your
three
team?
are juniors. These two on my right are fourth year trainees, and Dr. Ali Zaman is the first year trainee of cardiology.
Okay, that's fine.
Well, thank you very much for the introduction. I think best of luck to you all for the game today. And now we move to DOW Dolphins. So please, the captain, to introduce the team.
Assalamu alaikum. I'm Dr. Eram, representing as a team captain of DOW Dolphins. To my extreme left is Dr. Adil, and to my left is Dr. Hafsa, and to my right is Dr. Muniba.
Great. Thank you very much, and best of luck for the game today. So with this, we are now going to move towards the electronic coin toss. So can we have the coin, please? And as per random selection, I'm going to ask DOW Dolphins to either call heads or tails.
Heads, please.
Roll the coin, please. Let's see what it is. Okay, so it's a heads. All right, so I guess we have the Dolphins winning, but then again, we've got two more questions to go. The first one is whether you want to take the questions or you want to throw the questions.
We are going to take the questions first, please.
Okay, so it's been decided. The Dolphins have won the toss. They want to take the questions first. And now on your screen, you will have two veneers, two cases, A and B. So which one would you want to pick?
We are going to go for the case A.
So they have picked the case A and they want to take the questions. So I now move on to the next screen and we have the scenario on your screen. So I will now request the hunters to please read the scenario.
I can't see the scenario, please.
Okay. Technical team, can we have it on the screen?
Okay, so a 58 years old man presents to the ED with a 4-day history of persistent chest pain radiating to his left shoulder and arm. The pain is worsened with inspiration and lying down. He has been traveling recently by plane and car for work. He has a history of hypertension and hyperlipidemia. His medications are amlodipine 10 mg daily, hydrochlorothiazide 25 mg daily, atorvastatin 2 mg daily. His blood pressure is 146/88, heart rate 102, oxygen sats 95% on room air. He appears uncomfortable and stays sitting up in the stretcher. Lungs are clear to auscultation. Cardiac examination reveals a normal S1 and S2 with a scratchy sound during systole and diastole at the left lower sternal border. There's no edema. ECG shows sinus tachy with no ST changes, and the lab studies are pending.
Okay, so Dolphins, do you want to take a few seconds to go through the scenario?
Yes, sir. We would like to have
quickly. Yes, go through it. So we are now going to move to the first question, and you can have the scenario in between whenever you want it. So the first question on your screen, read it please, hunters.
Which one of the following is the most likely diagnosis? A. Acute coronary syndrome. B. Pulmonary embolism. C. Pericarditis. D. Costochondritis. E. Aortic dissection.
And the 60 seconds on your screen start now.
लग रहा
Okay, 20 seconds to go. We
would go with option C.
Okay, option C. Are you sure you want me to lock it?
Yes, sir.
Pericarditis, right? Okay, lock the option C. And yes, well done. Great start. Starting off with a 6, it's been hooked for a 6. Well done. Good job. So I think we now move to the second question. Hunters, please read the question.
Which one of the following should be included in his treatment plan? Prednisolone 30 mg OD with taper for 1 month. B. Anakinra 60 mg daily for 4 months. C. Methotrexate 15 mg weekly for 2 months. D. Colchicine 0.6 mg daily, twice daily for 3 months. And E. Ibuprofen 4 mg daily for 2 months with taper.
And your 60 seconds start now. We also have Professor Javed Sial with us. Welcome, sir.
Thank you. Thank you, Hamza.
D.
Twenty seconds. Come on, teams. 10 seconds now. 8, 7. Hurry up.
Option D.
Option D. So, just in the nick of time. Option D. Lock it, please. Oh, well done. It was a difficult one, I thought, for you, but you did well in the end. Well played. 6 again. Good job. So, we now move to question number 3. Great going, Dolphins.
Okay, which one of the following echocardiographic findings would be more specific for his diagnosis? A. Marked plethora of inferior vena cava. B. Septal shift of ventricular interdependence. C. Medial mitral annular velocity greater than lateral mitral annular velocity. D. High ratio of early mitral velocity to early mitral annular velocity. And E. Inspiratory hepatic vein diastolic flow reversal.
And the timer starts now.
Okay.
10 seconds now. Hurry up.
Sir, option C.
Sure?
Yes, sir.
Okay, lock option C. Oh, very well done. Another 6. This one is out of the park. I think it's a wonderful hit. It's a good wicket to bat on, and I think that's what the Dolphins are proving here. Good job. So we move to question number 4. Please read.
Which one of the following echocardiographic findings is the most specific in supporting the diagnosis of pericardial tamponade? A. Systolic right atrial collapse. B. Plethoric inferior vena cava with minimal respiratory variation. C. Exaggerated respiratory variation in tricuspid inflow velocities. D. Diastolic right ventricular collapse. And E. Mitral annulus reversus.
And the timer starts now.
Option D. Sir, we are going to go with the option D.
Okay, option D for Delta, that is, right?
Yes, sir. Delta.
You want me to lock D?
Yes, sir. Diastolic right ventricular collapse.
Okay, option D. Lock it, please. Oh, yes, very well played. Another one. Wow, 4 out of 4. So 4 sixes in a row. That's a great start. So they are definitely putting the other team under pressure. Well, the next question on your screen.
2 years later, he presents with the following findings: BP of 108 by 84, pulse 82, SATs 98%, pulsus paradoxus 6 millimeters of mercury, JVP of 12, and does not change with inspiration. Lungs clear to auscultation bilaterally. Heart rate has a normal S1, S2. There is an accentuated high pitched sound early in diastole. There are no murmurs or other extra heart sounds. Liver edge is palpable just below the costal margin, has mild ascites and trace pedal edema. TTE will most likely reveal which of one of the following: A. Cardiac tamponade, B. Constrictive pericarditis, C. Left atrial myxoma, D. Left ventricular systolic dysfunction, and E. Pulmonary embolism.
Please start the timer.
Sir, option B, constrictive pericarditis.
Okay, so you still have 25 seconds, as Professor Ishaq Saab would always tell you to take your time. You want me to lock it?
Yes, give it, please.
So option B? Should I lock it?
Yes, sir, constrictive pericarditis, option B.
Okay, lock option B. Let's see what it is. And yes, very well done. 5 in a row, 5 sixes on 5 deliveries. So I tell you, I think it's a wonderful start, but never mind. I think for hunters, there's a long way to go. It's a sunny day, hot, sunny and bright day, and the pitch is bouncy. It's a batting wicket, so it's going to be a high scoring game. So don't worry. Question number 6 on your screen.
Which one of the following changes following pericardiocentesis is most consistent with effusion constrictive pericarditis rather than cardiac tamponade? A. Cardiac output increases from 4 to 6 liters per minute. B. Right atrial pressure decreases from 15 to 111. C. Right ventricular systolic pressure decreases from 35 to 25. D. Persistent equalization of right ventricular and left ventricular diastolic pressures. And E. Pulmonary capillary wedge pressure increases from 15 to 20.
And the timer starts now.
Persistent equalization
I'm not sure about this. Chronic होता है मुझे इतना पता है. It's chronic congestive constrictive pericarditis यही होता है.
persistent equalization
ऐसा नहीं मुझे पेशेंट नजमा याद आ रही है. उसका मैं भेजा कि जो है persistent होती है पता है क्या कैसे कोरिलेशन नहीं है. Systolic pressure
20 seconds.
pericarditis.
10 seconds, come on.
Sir, option D, delta, persistent equalization of the pressures.
Okay, so lock option D. Let's see. Oh, that's the first one which has been missed. And that one was definitely an off-cutter right onto the pads. Never mind, that's your first miss. So, very well played. Still have a couple of more chances to put up a big score. Question number 7 is now on your screen.
Which one of the following factors is most important in predicting hemodynamic consequences of a pericardial effusion? A. Volume of fluid. B. Composition of fluid. C. Rate of accumulation. D. Pericardial thickness. And E. Patient's age.
Please, timer starts now. And I will request the teams to wait for the question to end before they start the loud discussion.
से जो वो फिर वो नहीं होता है कंपनसेट नहीं कर पाता तो रेट ऑफ इनफॉर्मेशन इसमें
Sir, option C, rate of accumulation.
Are you sure?
Yes, sir.
You want me to lock it?
Yes, sir.
Okay, lock option C. They've come down the wicket to play this one. Let's see whether it's a miss or a hit. And that's a hit out of the park for a 6. Very well played. Well done. Great job. So with this, we move to our next question.
Which echocardiographic finding would most likely rule out pericardial tamponade? A. Late diastolic collapse of right atrium. B. Inferior vena cava diameter 1.5 centimeters with inspiratory collapse. Mitral valve respiratory flow variation 30%. Tricuspid valve flow variation 60%. Reduced lateral mitral annular velocity.
And timer starts now.
Mostly until out. Pericardial tamponade. Metric respiratory variation of 30%.
IVC 1.5 with inspiratory collapse, so ये तो normal है, normal diameter
50% रिडक्शन होती है हमारे पास.
रिड्यूस, मतलब ये सोचे रिड्यूस लेटरल माइट्रल एन्युलर किस में होती है?
20 seconds.
इसमें जो
10 seconds now. Hurry up. 5. Come on. One option.
Sir, option E.
Okay, so option E. Lock option E. Let's see. Oh, that turns out to be a googly. Never mind. That's your second miss. You still have 2 more questions to go. So I think it's going to be a tough game. May just go to the wire. And question number 9 on your screen.
Which of the following catheterization findings most reliably supports a diagnosis of pericardial constriction over restrictive cardiomyopathy? A. Pulmonary artery systolic pressure less than 50. B. A prominent Y descent. C. Equalization of right and left heart late diastolic pressures. D. Ventricular interdependence. And E. None of the above.
And the timer starts now.
prominent Y descent and rapid descent.
अगर important capitalization की equalization कितना होती है right और left diastolic pressures के अंदर इसको चार्ट करना है
Restricted should be group में हो जाए.
So 20 seconds. Is it turning out to be tight death bowling towards the end?
B.
10 seconds.
Sir, option B, beta.
Okay, B, beta. Lock option B, please. Oh, yes, indeed it is. The bowling is getting tougher. Okay, so another one missed. Turns out a Yorker outside the off stump. So that's how I would look at it. But I still think you can put up a good score. It's your last chance. Question number 10 on your screen, and best of luck.
Pericardial tamponade in the absence of pulsus paradoxus is described with all of the following except A. Aortic regurg, B. Severe rheumatoid spondylitis, C. Constrictive pericarditis, D. Large ASD, and E. None of the above.
And the timer starts now.
In the absence of this, describe with all of ये pericardial tamponade हो रहा है, उसमें pulsus paradoxus नहीं मिल रही है, सब में मिल रही है. हो जाती है. Severe rheumatoid spondylitis. बिहार के अंदर
20 seconds.
प्रेजेंट होगी तो उन्होंने एब्सेंस सब में एब्सेंस होती है सिर्फ प्रेजेंट सिर्फ वो सब पूछा है तो फिर सी
10 seconds. Come
I
on.
would like to go with option.
Option C. C for cat. Okay, option C. Lock it, please. Yes, very well done. You've hit a long ball this time. 6 runs. And yes, what a great end to this good innings. Well played, Dolphins. And we have a good score on the board. Well done, well done. So now I think we're going to have a pretty tough fight. And as you can see, a total score of 42, 7 right answers. But I still think the pitch is good. Whether it turns out to be good in the end, we'll see. And I will now request Professor Ishaq Saab, our umpire, one of the umpires, to please give his thoughts.
Thank you, Hamza. I think it was very interesting, and they had a very good start, and the score is quite high. So for Mardan, I think it's going to be a big challenge. I'm glad that both sides have got some link. Tariq Farman, the mentor of this team, has been my student, and I studied in Mardan for 2 years, my college years. So wish good luck to both of you, both of the teams. I think this question was quite a clinical question and something that we come across every day. And the answers, I mean, the whole question was relatively simple compared to what we have in our matches in the past.
Yes.
But nevertheless, they did very well. So let's see how the Mardan people do it now, how they respond.
Thank you very much, sir, for your input. As always, I would also request our other umpire, Professor Abdul Hamid Siddiqui Saab, if he's there, to give his thoughts on the game so far and the total that we have.
I think very good clinical scenario. Initially started off with the easier answer and then build it up with the somewhat intricate findings, as we see in tamponade and constricted pericarditis, and a good score by the Dolphins. Let's see what Mardan Hunter do.
Very rightly said, sir. I think it's going to be a good fight. And we also have the panel of experts, Professor Fawad Farooq Saab, the dynamic Professor Fawad. Is he there? Okay, so I think we have, do we have Professor Hafizur Rahman Saab? Is he there? Okay, so I guess with this we move
I believe
to...
we have Professor Javed Akbar Sayal here.
Okay, Javed Saab, yes, please. Javed Saab, are you there?
Yes, thank you, Hamza. Today seems to be a high-scoring match, or Ishaq Saab said that Tariq Farman and everywhere. If you think in Pakistan, every institution there is a student of Professor Ishaq. So Professor Ishaq के सारे जितने centers हैं, वो सारे Professor Ishaq के students के हैं. So definitely, आज का जो contest है, it's quite interesting and high-scoring match. And initially, this DOW International did very well, except these few wrong answers. But let's hope for the best wishes for Mardan. Today, I think contest will be very, very कांटेदार का मुकाबला आज होगा इंशाल्लाह.
Thank you very much, sir, for your input. So I now believe it's going to be a tough match. They really have to play well, the Hunters. And now we move to the second half. So let the play begin. Let the second half begin. We have the Winnie in front of you, and I will request the Dolphins to please go ahead and read the scenario.
A 39-year-old woman is referred from her primary care clinician for dyspnea and exertion. She feels short of breath after climbing one flight of stairs, whereas 6 months previously, she could climb the stairs without difficulty. She has 2 children, 18 months of age and 4 years of age, and she's having trouble keeping up with them due to shortness of breath. She underwent lumpectomy for ductal carcinoma in situ 1 year earlier without the radiation therapy. Her only medications are tamoxifen and a daily multivitamin. She is a lifelong non-smoker, drinks alcohol socially, and does not use illicit drugs. Her family history is remarkable for a mother who died suddenly at 52 years of age. She had a pacemaker implanted in her 40s. On examination, her blood pressure is 127/83, pulse is 90 beats per minute, and oxygen saturation is 95% on room air. The examination is remarkable for a normal S1 and S2, a faint grade 1/6 systolic flow murmur that does not change with Valsalva, a JVP of 10 centimeters of water, and a trace bilateral lower extremity edema.
Okay, Hunters, so you have a few seconds to gather yourself and go through the scenario. You want a few seconds?
Yes. Cardiomyopathy. Cardiomyopathy. Pericarditis. Tamoxifen. Tamox. 1/6 systolic flow. That does not change with Vasana. JVP तो raised है. JVP raised है तो means heart failure तो है.
Okay, so I think we are now going to have the first question on the screen, and you can have the scenario whenever you want it on your screen. Here you have the first question.
Which of the following is patient's most likely diagnosis? A. Ischemic cardiomyopathy. B. Chemotherapy-induced cardiomyopathy. C. Familial dilated cardiomyopathy. D. Peripartum cardiomyopathy. And E. Heart failure with preserved ejection fraction.
And your 60 seconds start now. Come on, we are expecting a good start.
1 year. 1 year. 1 year से peripartum नहीं हो सकता. That is familial. Mother भी थी. सी और बेबी उसका 18 मंथ्स का था ना. ठीक है, तो पेरीपार्टम रूल आउट हो गई. ठीक है, पीछे रह गया. 1 साल से मेरी. हाँ, तो वो भी नहीं हो सकती, तो पीछे सी रह गया क्योंकि फैमिली हिस्ट्री है.
20 seconds.
Chemotherapy induced. Alizumab B. C. Okay.
10 seconds. Come on.
C. Familial dilated cardiomyopathy.
Okay, so lock option
Okay.
C.
Okay, change. B.
No.
Please lock B.
Okay, can I have the umpire's input on this? What should we do, sir?
I think they have time, and so they have switched to B. It's okay.
Okay, so what's your last answer? What do you want? Which option, please? Hurry up. You have to answer
They've already done B.
B, sir.
B. Okay, so they are saying it's B, chemotherapy-induced cardiomyopathy. Lock the answer, please. Oh, goodness. Turns out it was a googly. You were right there. Missed it. Well, so be clear. You still have 9 more questions. So you can still do it. Can we have question number 2 on your screen, please?
Her hemoglobin is 13.6 gram per deciliter. Ferritin level is 250 nanogram. And her iron saturation is 16%. Which one of the following would be most appropriate for the management of this patient? A. IV iron sucrose. B. Transfuse-packed RBCs. C. Oral ferrous sulfate. D. Oral vitamin C. E. Subcutaneous erythropoietin.
And the timer starts now.
13.6. A. नहीं. A. Iron sucrose. Ferritin levels 250. Ferritin levels का है ना, और iron saturation 16% है, तो we will go IV iron sucrose A. नहीं, it's कर लेते हैं. देखें ना, वाइट ओरल तो दूंगी नहीं, सबक्यूटेनियस एरिथ्रोपोइटिन. क्यों? नहीं, ओरल विटामिन सी नहीं दे. लेकिन है तो सही में, केस तो है ना डीसीएम.
So 20 seconds.
वो कर लेना. ओरल का असर कम होगा ना.
Approaching 10 seconds now. Come on. Hurry up. Yes.
A.
A. So it's option A. Lock it, please. Oh, yes, very well done. And I was just holding on to my horse and praying that you would go for this. And very well done. This is a big 6. Although it turns out it became a bit tricky, but I think a good swivel and a good score, good 6. So as Dr. Isaac always says, along with the other panel members, that you must take your time. It is the collaboration of the students and the team together of deduction which goes on over there, which enables you to rule out the options, and then you can focus on the right option. So my little tip, be very clear about the answers, and when you approach the last 10 seconds, I think that's when you should have something in your mind and you should be ready for the answers. So I think with this, we now move to the next question on your screen.
She is found to be in her atrial fibrillation with rapid ventricular response. Despite adequate diuresis, her heart rate is poorly controlled with escalating beta blockers. A transesophageal echocardiogram shows no evidence of left atrial appendage thrombus, and she undergoes electrical cardioversion with restoration of sinus rhythm. In addition to anticoagulation, which one of the following is the best treatment option for this patient? A. Amiodarone, B. Clonidrone, C. Diltiazem, D. Sotalol, and E is flecainide.
Timer starts now.
देखें अमाइड्रोन को तो छोड़ दें पीछे ना, मतलब वो कंप्लीट वैसे पेशेंट बी भी निकाल दें, उसी की फैमिली आ गई। डिल्टाइजम नहीं दें क्योंकि बीटा ब्लॉकर्स नहीं मिल रहा, तो सोटालोल जो है वो सोटालोल शॉर्ट एक्टिंग है, पीछे फ्लेकेनाइड बच गया। आई थिंक इट शुड बी, व्हाट डू यू थिंक? फ्लेकेनाइड देखिए ना, वो दोनों फर्स्ट वाले दो तो एक फैमिली के, जस्ट रूल। एक तो पेशेंट है भी कार्सिन, वो भी है ना, आई मीन उसको हिस्ट्री भी आ रही है फैमिली नहीं, लेकिन डाययूरेसिस हो रहा है तो फेलियर का तो डेल्टियाजम।
So 20 seconds.
Atrial fibrillation.
Come on, Hunters.
Heart rate is poor control.
10 seconds. Come on.
Sinus rhythm restore हो गया।
Come on. 7, 6,
क्या
4, 3. Come on.
C.
Okay. So I would like to ask the umpires, should we give it to them? Because they've said C and we were almost down to
Almost zero.
almost 0.
I think you can give chance to them this time, but I think they should try to answer before 5 seconds.
Right, sir. So should we give it to them then if they do it correctly?
Please also ask Professor Ishaq for this.
Sir, you are mute. Professor Ishaq sir, you are mute.
Can we have Professor Ishaq sir?
I think we should give them. They were just about. You see.
Right, sir. Right. So the margin of error, according to the umpires, goes to them. So lock the option, please. Option C. Oh, that was a straight delivery. I thought this would go out for a 6. And you've missed a straight one, I tell you. But never mind. Now you really have to buckle up because I think you've missed 2 deliveries. You don't have a lot of margins left. Come on, Hunters. Next question on your screen.
If her heart failure was due to immune checkpoint inhibitors, which one of the following would be expected on endomyocardial biopsy? A. Interstitial inflammation with lymphocytes. B. Non-caseating granulomas. C. Apple green by refrigerants of Congo red stained tissue under polarized light. D. Multinucleated giant cells. Or E. Eosinophilic infiltrates.
And the timer starts now.
एप्पल ग्रीन वाला तो होता है अमाइलोइडोसिस, मल्टी न्यूक्लिएटेड टीबी की वजह से हो गया। एओसिनोफिलिक जो हिस्टोप्लाज्मोसिस की वजह से होता है। नॉन केजिएटिंग ग्रैन्युलोमास है,
क्रोहन्स या अंडरलाइन कोई इन्फ्लेमेटरी डिजीज हो, तो ये तो इन्फ्लेमेटरी नहीं है
इम्यून
ना।
चेकपॉइंट इनहिबिटर्स क्या है?
क्या चीज?
25 seconds. Hunters, come on. 20 seconds.
बताओ या हिस्टोप्लाज्मोसिस है, जल्दी बोलो।
It's interstitial inflammation.
10 seconds. Please hurry up.
High blood pressure.
जल्दी बोलो।
7,
कर दें, फिर उसके बाद
6,
खत्म हो जाएगा।
5,
Option A.
Okay, lock option A, please. Yes, very well played. Yes, that's a 6. Well done. Very well played. So we are still holding on to our seats. Good job. So can we have question number 5 on the screen?
She denies edema.
She denies edema or orthopnea, but reports dyspnea and fatigue when walking up in an incline or carrying groceries. She's on carvedilol 25 milligram BID, enalapril 10 milligram BID, furosemide 20 milligram OD, and spironolactone 25 milligram OD. On examination, her heart rate is 62 beats per minute and BP is 105 by 64 mm of mercury. Her JVP is mired at 8 centimeters of water, lungs clear, and no lower extremity edema. Labs reveal a serum potassium concentration of 4.5 MEQs per deciliter and a creatinine of 1.2 milligram per DL. What is the best next step in the management of this patient? A. Add ivabradine. B. Replace the enalapril with sacubitril valsartan. C. Increase the furosemide. D. Replace carvedilol with metoprolol succinate. Or E. Decreases the carvedilol.
60 seconds on your screen now.
आइवाब्रेडिन को छोड़ दो, आइवाब्रेडिन निकल जाएगा क्योंकि 75 हार्ट, क्योंकि 62 हार्ट रेट में, तो आइवाब्रेडिन का कोई काम ही नहीं, वो निकल गया पीछे। ऑर्थोपनिया उसको नहीं है,
फेलियर नहीं है तो फुरोसेमाइड नहीं है, ठीक है। कार्बिडालोल को कम करने का कोई तुक नहीं है क्योंकि
हाँ वो तो इसको क्या है,
और मेटोप्रोलोल तो वैसे ही डिस्निया में नहीं देते, सही है,
ठीक है।
तो बस एक ही रह जाता है
रिप्लेस एनालाप्रिल विद बी, हर जेवीपीज में, हाँ बस बी रह गया। लेकिन देखें शी डिडंट एडिमा और ऑर्थोपनिया, ठीक है। एंड फटीग व्हेन वॉकिंग, बस सही है, बी इज फाइन आई थिंक। कोई फ्यूरोसेमाइड इंक्रीज करने
20 seconds.
कुछ भी नहीं, तो आई गेस बस बी करेंगे जो गाइडलाइंस है, रिप्लेस एनालाप्रिल विद sacubitril valsartan।
Okay, then we go with B.
Are you sure you want me to lock it?
Yeah, yes, sir.
Okay, option B it is. Lock the option B. Yes, very well done. Another 6. That's been cut for a 6. I thought you really played that well. We enjoyed the discussion that you had and you were ruling out the options. This is the way you do it. Very well done. Good teamwork. Well done. So you're still in the game.
Keep it up.
Great job. As the words are also coming from the experts, we now move on to the next question with a lot of hope.
All of
The following are associated with the high BNP levels except A. Obesity, B. Patient on sacubitril valsartan, C. Hyperthyroidism, D. Septic shock, and E. Pulmonary embolism.
ओबेसिटी में भी हाई होते हैं, ओबेसिटी में हाई होते हैं, वो मैंने देखा। बी बी सही है ना,
बी है क्योंकि
वो तो कम करता है।
हाइपरथायरॉइडिज्म में फेलियर होगा,
इसको तो वैसे ही वो कम
सेप्टिक
करता
शॉक में भी पल्मोनरी एम्बोलिज्म है,
हाइपरथायरॉइडिज्म में भी तो बी रह गया, sacubitril valsartan पे।
सर बी सर।
Okay, that was a quick fire. You want me to lock B or you want to take some time? Yes, you can take your time. Yes.
हाइपरथायरॉइडिज्म में तो नहीं है कहीं,
इट्स नॉट पिक्सी,
और sacubitril valsartan तो कम करता है ना उसको, तो आई थिंक इट शुड बी बी, इट शुड बी बी। डिक्रीज द बीएनपी लेवल्स, ऑल फाइन।
नेप्रोलाइसिन होता है ना,
नेप्रोलाइसिन इनहिबिटर्स, फाइन।
15 seconds.
आई थिंक ओबेसिटी में तो होती है।
बी बताना ना,
बी बस सही है, बोल रहे हैं, आई
बी बोल दिया।
10 seconds. Come on now.
बीटा बी।
Okay, so they want us to lock the option B. Oh,
Why obesity? It's written in the book.
okay. So, that one turned out to be a difficult one in the end. I think a lot of discussion was going on. But never mind, it's really getting tighter now and you can only draw from here on and you have to answer all the questions. Come on, you can still do it. So, question number 7 on your screen.
Which one of
the following patient characteristics most likely explains the normal BNP in patient with symptomatic heart failure? A. Age 79 years. B. Male sex. C. Left atrial volume index of 39 ml per meter square. D. Mean E to E prime of 15. And E. Body mass index of 38 kilogram per meter square.
Start the timer.
अब अगेन बात हुई है ओबेसिटी में अगर कम होते हैं तो फिर
तो नीचे वाला
नीचे वाला होगा, लेकिन बात हुई ओबेसिटी की भी क्लासिफिकेशन नहीं पूरी हुई ना, 38 है ना ये तो सही है।
और E/E रेशियो ऑफ वो डायस्टोलिक डिसफंक्शन है और लेफ्ट एट्रियल एनलार्जमेंट है ये, तो मेल सेक्स है और
एज के साथ एसोसिएशन होता है बीएनपी का, नहीं उसमें तो रेज्ड होंगे, रेज्ड होंगे एज के साथ तो रेज्ड होंगे।
20 seconds. Come on,
क्या है?
hunters. 15.
आप क्या कहते हो?
आप क्या कहते हो?
E
10. 9. 7. 6. Come on. One option.
Okay, E. Option E.
Option E. So lock option E. Yes. Very well played. Well done. It was a tricky one, but I think you closed your eyes and just stroked it out of the park. Well done. Good job. You're still in the game. So we're moving on to the question number 8. On your screen, please.
Which one of the following parameters for patient with acute heart failure carries the most adverse prognostic significance with respect to in-hospital mortality risk? A. Systolic blood pressures. B. Serum blood urea nitrogen. C. Hemoglobin. D. Serum sodium. E. Atrial fibrillation.
Okay, 60 seconds. On your screen.
I think A.
C या A?
Less than 100 हो तो
C या A?
नहीं, वो 130 से कम
नहीं,
हो तो,
सोडियम
130 से कम हो तो,
हाँ,
और सिस्टोलिक ब्लड प्रेशर है रिस्पेक्ट टू इन हॉस्पिटल
it should be
मॉर्टेलिटी
A
रिस्क।
या C।
अच्छा, सोडियम क्यों? हम कोई डाई यूज करते हैं तो सोडियम पे तो कुछ नहीं होता, तो लॉन्ग टर्म यूज करें तो फिर होगा।
सिस्टोलिक बीपी
एकदम से तो नहीं कम होता, एकदम
इन
से तो नहीं
हॉस्पिटल
कम।
मोर्टेलिटी रिस्क,
25
so I guess it
seconds.
should be systolic बीपी। हाँ,
एट्रियल
Come on.
फिब्रिलेशन देर से होगा,
नहीं
acute
एट्रियल
heart
फिब को
failure।
आप करोगे
15 seconds.
बस A कर दें, I think it should be A।
10 seconds.
बताओ इसका
इसका
scoring?
तो HPV ठीक था।
Come on, hunters. 5 seconds. Hurry up. 1. Option.
A.
So it's option A just at the last moment, and let's see what it is. Oh, yes. It was an inducker, and this one has been missed. So it was option B, and now we know the outcome of this game. But I think we're still going to go with the next two questions, and here we have question number 9 on the screen, please.
क्वेश्चन पे डाउट है ओबेसिटी वाले पे। चलें,
Which one of the following is a marker of good prognosis in this patient? A. Mitral E to A ratio 1.2. B. Maximal oxygen consumption of 22.7 ml per kg per minute. C. Potassium of 5.1 milliequivalent per liter. D. Left ventricular internal diastolic dimensions of 6.2 centimeters. E. Incomplete right bundle branch block.
And the timer starts now. Hunters, you still need a good score because this may just help you in the tournament.
A.
मैक्सिमम ऑक्सीजन
I think A है। नॉर्मल जो है वो
माइट
क्यों भी लगता है? मैक्सिमल
गुड प्रोग्नोसिस
नॉर्मल ऑक्सीजन कंजम्पशन कितनी होती है? पोटेशियम वाला तो गलत है, ये डायस्टोलिक डायमेंशन भी बहुत ज्यादा है। इनकम्प्लीट
आरबीबी वो भी नहीं होगा, गुड प्रोग्नोसिस तो नहीं
A
है
या B में से।
सो आई थिंक इट शुड बी बट मैक्सिमम
25 seconds.
25 होती है ना,
25 होती है।
So 15 seconds. Hurry up.
क्या करूँगी ये?
आपको क्या लग रहा है?
10 seconds.
A
Come on, hunters.
B कर लें।
B.
Option B. All right. Lock option B. B for bat? Yeah.
जी।
B. Option B to be locked. Yes, I think this was very well played. Very well done. Well done. I think this one goes to you. Good thinking in the end. Played it smartly and thought it out well. Good job. So we have the last question now on our screens. Good luck, hunters.
One of the following best describes the impact of an elevated galectin 3 levels. A, reduces the benefit of a primary prevention implantable cardioverter defibrillator. B, indicates the need for inotropic support. C, increases the risk for rehospitalization. D, increases the risk for deep venous thrombosis. E, indicates the need for pulmonary vasodilators.
Okay, the timer starts now.
Galectin. Impact elevated. Galectin 3 elevated.
Indicate the need for energy, risk for rehospitalization. Risk of
देखें है तो अच्छी चीज नहीं ना गैलेक्टिन 3 ठीक है पहली बात ये अच्छा वी आर डिस्कसिंग अच्छी चीज नहीं है बात ये कि इट विल indicate for pulmonary vasodilators.
Approaching 20 seconds.
Best describe the impact of elevated galectin 3 level.
10 seconds. Come on, come on.
Increase of the hospitalization.
9,
Go for
7.
C. C.
Okay, option
Charlie.
C. Lock option C, please. And yes, very well done. I think again, you very well played, well thought out. And with this, I think we have come to the end of the second innings. It's a score of 36. I think it was a close game in the end, just a difference of one question. And Dolphins winning it in the end by a margin of one question. But I think it was well fought by both the teams. So congratulations to Dolphins, commiserations to Hunters, but I think you've done very well, and this may help you in the next games as well, because the fight is still on.
I have a question. Can we ask a question?
Yes, sure. Please go ahead. Who's this? Who is this?
We are not MMC Hunters, please.
Okay.
So we have a doubt about a question which you asked about raised BNP. What we have read is that it is raised in obesity. Can we check that out, please?
Okay, so we have the umpires. Both the umpires are here, Professor Isaaq Saab and Professor Abdul Hamid Saab. Sir, your inputs, please.
Yeah, I think that was a good question, and I went through this. We have got the references to support this answer.
Yes, so it's written in Topol edition 5. That's for sure.
So we can produce the references in support of the answer that was taken as correct, because it sounds as if what you are saying appears to be the correct answer, but that is not the correct answer. So we will provide you with the references.
Okay, sir. Thank you, sir.
Okay, I think it's been nicely put by the umpires. They'll have a review. They'll give T-shirt.
Hamza, Wilson, I will give you the reference, and you can forward them to the MMC.
Yes, surely, sir. We'll forward the references. Yes, sir.
And thank you very much for pointing it out.
Conditions which increases that.
Yes, surely. I think this was nicely pointed out, and I would also request our other panel of experts. Okay, please hold on, teams. The experts, they still have to give their opinions. So can we have Fawad Farooq Saab, is he there? Or Hafizur Rahman Saab? Or Javed Syal Saab? Anyone who's still with us? So Abdul Hamid Siddiqui Saab?
Yes, yes. I think very well played Madan Hunters. They could have easily equalized the score, because a few questions that they dropped were easier, but they answered very tough question in the end. So I think tried to compete very well. Both scenarios was very good. So good luck for the future for them again.
Thank you very much, sir. No doubt, indeed, it was a close game, and I think some of the questions, they were tackled very nicely. And initially I knew it was a sunny day, and I knew it's going to be a high-scoring game. So almost more than half of the questions were answered. So this gives us a lot of hope and reassurance that our teams are well prepared and they are doing a wonderful job. So with this, I would like to ask our umpires and worthy panel members to have any more comments. If you have, sir, if you would like to say anything else.
Yes, Hamza,
sir.
I would like to congratulate both the teams. They played very, very well. The questions were, scenarios were almost at par. Some of the questions were very simple and some very complex. So I think, but that was a balance. The questions which were answered by Mardan team were quite difficult one, some of them. But that's the game, you see, because they chose for the scenario. But both the teams, I think, played very well, and they had a very good concept about the physiology. And I would like them to be encouraged. And one team has to win, the other team has to lose. And with, as you said, with one answer, it could have been a tie. But I think both the teams played very well, and this is very interesting because sometimes the question appears to us a correct answer, and that is not the correct answer according to the references that we have accumulated. So the person who is setting the questions has a great responsibility to make sure that the references are valid and they are reliable. So I think the Mardan team has pointed out a very good point, because if you look at a glance, it appears that they were right, but the references are different. So I think this is how the exams are. Sometimes you think that this is the correct answer, and that's not the correct answer, and sometimes you think this is wrong, and that is comes out to be a true answer. So I think they should not take it that way. And but I am very really impressed with both the teams, their preparation, because some of the questions were quite difficult, to be honest. At least for me, I don't know about Amit Siddiqui sahab, but one or two questions puzzled me as well. तो यही होता है कि 10 में से 5 सिंपल, 5 5 में से 10 में 3 बहुत सिंपल, 2 एवरेज और 4-5 difficult, and that determines the outcome of the game. So I think very good, healthy competition should go on. Mardan is a relatively new medical college, new environment there, and DOW is a very old institution, so थोड़ा difference तो होगा ना, लेकिन फिर भी मैं कहूँगा कि मर्दान और ने they have played very well. So both the teams are very dear to me, and I must congratulate them.
Thank you very much, sir. I think wonderful input, like always, and you are extremely dear to all of us. I think you've been a teacher to so many of us, and we all try to follow your footsteps. And I think it's a lot of learning going on for all the teams. So again, as we all say, कि मुकाबला नहीं है, मुकाबला जो है वो सिखाता बहुत कुछ है. When you win, you get a lot of things. But I also believe when you lose, it ends up teaching you a lot. So आप हार से भी बहुत कुछ सीखते हैं. And I think I do agree that some of the questions were difficult, some were easy, but in the end I think whosoever is setting these questions up, there's a whole panel who sets it up, and then there's a system of reviewing them, and obviously all these answers are backed up by references. So, but then again, this is how it goes. So again, well done. It was a great match today. We really enjoyed, and I think both these teams are going to go a long way. So with this, I now come to the end of today's match, and we'll sign out today. I think it was great having you. So stay safe, and inshallah, we'll see you soon again. Allah Hafiz from me.